My name is Ruth Kleinpeter. I am Ben Kleinpeter's mom, and I am a pediatric physical therapist. I bet many of you probably didn't even know that. I have been a physical therapist for 20 years now. I'm a licensed physical therapist. I graduated in 1999 from Armstrong Atlantic State University. It's now Georgia Southern, of course, as you know. Let's see, I got my Master's of Science from Armstrong, got my undergrad from Mercer University. And I started off working at St. Joseph's Hospital doing acute care and rehab care with adults, but then soon moved over to Candler Hospital and started doing pediatrics over there, which I absolutely loved. Worked with all age children, starting with little bitty babies that are, probably my youngest patient was probably 6 weeks old. I still actually keep in touch with them today, which is pretty awesome. And then I had kids, probably like teenagers, but most of the kids were probably toddlers to maybe 8 years old, somewhere in that range. And most of them had neuromuscular disorders. But I love treating babies too. Babies were fun. Oh, I forgot to introduce Holly. This is my sidekick, Holly. We love Holly. She's with us all the time, especially since we've been home 24/7, and she loves it. Anyway, back to me. So I worked at Candler Hospital. I did also work at the Matthew Reardon Center, which is a school for children with autism, some, but mostly at Candler. And I worked part-time a little bit after Carter was born, but then once Ben was born, I stopped working altogether and just became a mom. So I don't really work anymore. That's why you see me all the time. But my sister-in-law, Jane Yacklin, is a pediatric occupational therapist. So she and I talk all the time about therapy. So I'm here just to kind of give you a little bit more insight on what pediatric therapists do, and hopefully to help you out a little bit more with your project. I know you've all been working really hard on it, hopefully coming up with a great toy design and prototype for your client. I know Ben has. So let's see, look at my outline. Okay, so what is cerebral palsy? I know you've already been studying a lot on cerebral palsy, and you probably already know, but it is a motor disorder, and at some point either in utero, which is when you're in your mommy's tummy, something happens in the brain that causes the pathways or the signals from the brain to your muscles to not work properly. And therefore, the muscles don't work the way that they should. And it affects walking, it affects your fine motor skills, handwriting, cutting, throwing, balance, a lot of balance, coordination, posture. And it can be either very, very mild, where someone might just have a limp when they walk, or it could be very severe. And the child or the person, if they're an adult, has to be in a wheelchair and require complete care the rest of their life. So there's a very broad range when someone has cerebral palsy. I'm going to need Ben to go somewhere else because he keeps making funny faces to make me laugh. Go, Ben. Go. Anyway, okay, thank you. Go. This is probably like all of the Zoom meetings. There's always some distraction. So cerebral palsy could also occur during birth. Something can happen to the brain during birth, or those first few weeks if it's a preemie, when the baby's in the hospital, in the NICU, something happens then, that causes their development to not go quite as planned. And you can have what's called diplegic cerebral palsy, which means it affects just the lower limbs, the legs, or hemiplegic cerebral palsy, which is just half of the body, so it's like one arm and one leg, just the right side or just the left side. And those are the type of patients that I would see more often. And then your quadriplegic cerebral palsy means quad, which is 4, so it would be arms and legs. And those patients, if they're severely impaired would definitely be in a wheelchair and require usually a parent or a caregiver to take care of them all of the time. So the goals for those patients a lot of times would be getting in and out of their wheelchair, sometimes just sitting, help using the restroom, different things like that. The goals would be very, very different than a child that just had a limp when they were walking. They'd want to work on higher level skills. So as a physical therapist, Ben, go inside, please. Thank you, sorry. As a physical therapist, what I would work on would be what's called gross motor skills. So gross motor skills aren't like nasty and gross and disgusting. It means large muscles. Gross as in large. So that would usually be the legs. So that would be the quads, the hamstrings, the calves. But always, 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 don't know if y'all talked about this or not, always involve the core or the trunk. Because always in children with cerebral palsy, no matter how mild, how severe, if it was, diplegic, hemiplegic, quadriplegic, it would always have a weak core, have weak abs, always. So you would always work on core muscles. So those would always be gross motor as well. And the occupational therapist would work on those as well. Because if you want a child to sit up and work on their handwriting or work on their feeding skills, you don't want them slumped over because it's really hard to write, or to be able to feed if you're always slumped over. So they would want to work on the core skills too. Oh, I thought we have a visitor. You never know, huh? Ollie wants to get down and go see where he's going. I think that was Carter. Anyway, so the physical therapist will work on gross motor skills, which is usually walking, jumping, balance, going up and down stairs, walking and running on uneven surfaces, up and down curbs, ramps, riding bicycles, skipping, any functional skills that children normally do and would want to do that involve those bigger, larger muscles. An occupational therapist would work on fine motor skills. So what fine motor skills are usually the smaller muscles. So typically they would work on muscles that involve the arms. And physical therapists would usually work on shoulders too, but then where are you going? But the occupational therapist would work on like elbows and hands and the fingers and the wrists. So a lot of the stuff that they will do will have to do with handwriting and eating and grabbing and grasping and anything with these smaller little muscles that you see in the arms and the hands. And so for children, since we're talking about children, a child ages 5 to 8, a lot of it has to do with handwriting, coloring, eating, grabbing things, playing with toys, manipulating toys, because that's what kids do. That's their job, is to play with toys and go to school. So anything that they would do at that age are the things that you would work on in therapy. So how do you even know what to work on in therapy? Great question. What we would do is we'd always, the first time you'd see a child, is you would assess them with some type of test. I know that doesn't sound fun, but we'd always make it fun. And so the different types of tests that we would use, the main test for the little ones is called the Peabody Developmental Motor Skills Test number 2. And there's one for the gross motor skills and there's one for fine motor skills. So one's for the PTs, one's for the OTs. And that test you could use from the babies all the way up to 5 years old. And then the test that we would use for the older kids, actually it would start from age 4 all the way up to age 21. It's called the Brunics-Ostrowski, it's hard to say, test of motor proficiency number 2. And that would test the same thing. There's a test for gross motor skills and a test for fine motor skills. And what you're looking at is those typical developmental skills that a typical child that's developing normally or typically, what type of milestones they would reach at, say, 3 years old or 5 years old or 8 years old. Or if it's babies, 3 months old or 6 months old. So, at 3 months they should be rolling over, and at 6 months they should be sitting up all by themselves without help, and 7 to 9 months they should start crawling, and at 12 months they should start walking. So all those different things, and then all the way up through 21 years old, there's different milestones, developmental milestones that a child should be able to reach. So we would do these tests, but we would make them fun. They'd be fun activities that we'd make them do to see if they can, where they are. And then you'd grade it and say, well, this particular child with cerebral palsy is actually performing, like say the child was 5 years old. You do all these fun little tests and games. They're actually performing maybe where a 3-year-old would be because of their disabilities, because of their muscles not working properly, and they can't perform those motor tasks, whether it's the gross motor muscles, or the fine motor muscles, depending if it's the physical therapist or the occupational therapist. And we'd score that down, and then we'd be able to make goals according to that. So after we figured all that out, then we'd say, okay, well, little Johnny, he's 5 years old, and he's, he can walk okay, but when we try to go up and down stairs, he just can't do it. He can't separate one leg from the other and go up one stair, and then the next leg, or go down the next step, unless he holds on real tight to the rail, or holds on to his mom, or holds on to me, or he can't go up a curb. That's a really, really big deal, is going up and down curbs. I know most of you're walking in a parking lot or going to the store and you have to go up the curb, to get to the store. You don't think twice about it. But for a child with cerebral palsy that can't make their muscles work right, they can walk okay, with a little limp, but going up and down a curb, that takes a lot of muscle coordination and balance, again, in your core, in your trunk, to be able to do that. So we would come up with different games and activities and therapy tactics to work on strengthening those muscles. Or if they were tight in certain muscles, we'd stretch them out, and different things like that. So when you're thinking about your toy that you're having to develop, and I know most of you have probably already come up with a toy, hopefully, and you're trying to fine-tune your idea, think about what it is that you're working on. So if you're doing something for an occupational therapist and you're working on those fine motor, muscles of the hand, and say, this child wants to learn how to cut out a circle, or cut on a straight line. I mean, I know most of you think, oh, that's easy. Well, for kids that can't, manipulate scissors, because that requires a lot of fine motor control and coordination, that's a pretty big deal to cut on a straight line. You need to do something where they could work on that grass, a toy that would work on the grass. And so when you're thinking about that, and of course you want to make it fun and interactive, because just like y'all are 11, 12, 13 years old, we all even get bored. But imagine a little kid, 5 to 8 years old. They want it to be fun. They want it to be colorful. They want it to be, maybe a certain character that they like, Paw Patrol or whatever characters they're into these days. I don't even know. They're that young now, since mine are older. But you want it to relate to whatever they're into now. So I know with Ben's that he's working on, his is more the physical therapy route, since he and I discussed it. I told him the first thing you have to look at is core control. You have to work on these muscles. And so, trying to cue a child to sit up straight, is the first thing to work on that. And then, of course, if you want to work on the legs, his has to do with working on legs. And one really difficult thing for a child with cerebral palsy is to what's called disassociate one side of the body from the other. They always want to use it at the same time because their brain has difficulty separating one side from the other, because that's part of, the insult or the injury that happened either when they were in their mommy's womb or, when they were delivered. Whenever the injury happened, is that part of the brain just cannot quite separate one side from the other. So they want to do things at the same time. Use both arms, even though one's weaker, or both legs. So to try to get them to separate one leg from the other, he's developing a toy to help them do their feet. You know, scoot them along, one foot, then the next foot, and the next foot, and then the toy will light up, you know, in all the different ways that he is designing it to stimulate, you know, the child's interest and to keep them interested in that toy. Are you leaving me? Are you done? She's bored. Oh well. Bye, Holly. So you want to make sure that your toy is incorporating all the things that the child needs to work on in therapy. You know, the strengthening or the stretching, whatever it is you're working on, that particular muscle. It's working towards the goals that the child needs to reach, the functional goals. And then of course it's engaging and it's stimulating. It keeps their interest. Look on my thing here. I think I'm almost at my time. But anyways, so those are the main areas that you want to make sure that you hone in on with your toy. It doesn't have to be some fabulous toy because obviously you guys are in 6th grade, but just keep in mind that what you're doing here is you want to just critically think through all of the areas that Ms. Hunt has been working with you with this project Lead the Way, and the engineering process and all the different questions that you need to answer as far as the toy that you're designing, whether it's for the occupational therapist or for the physical therapist, and will it help the therapist meet the goals that she's working on with the patient. And the goals are always function-based. They're always whatever the child has to work on. If the child needs to try to, you know, I don't have a button shirt on, but if I did, you know, she's trying to learn, she or he, to button her shirt, or to button his shirt, or to button the pants, or do a belt, or to you know, tying shoestrings is hard for any kid, really, to learn. But imagine a child with cerebral palsy that just can't use their hand right at all. You know, that is a huge goal. And if it's a child that can't hardly use their hand at all, they might just be reaching for a device, you know, to help them speak, or help, you know, whatever it is, activate. A child that's severely impaired might be using, you know, forgot what they're called, but the things that the speech therapist would use to help them speak for them, and they're just activating that device. I mean, just touching it, a target. You know, a child with cerebral palsy, if you've seen a video, you know, their hand, they can't make it stop. You know, they can't coordinate it and make it stop so they can touch the button. So they work on that. And like I said before, with a physical therapist, they will be working on balance, because a lot of them, they can't sit like I'm sitting like this. They're rocking all over the place, or they're slumping over, or they're doing that. So you do all kinds of different exercises just to help keep their balance and sitting first. And after sitting, then maybe you can work on reaching, you know, and then after that, maybe you can work on standing up all by themselves, and then walking, and then all those other different tasks that every kid can do. So anyways, I hope this helped you. I hope that you're coming along great with your toys, and you're going to come up with some fabulous things, and you're going to finish the year strong. And I encourage you to, you know, email or Google Meet with Ms. Hunt whenever you can. And of course, if you have any questions for me, I'll do my best to try to answer them. You can email me. My email is Ruth Kleinpeter at Comcast.net, and I can try to answer questions for you. Anyways, everyone have a great rest of the year. Only a few days left, and then it's summer. I know that's hard to believe, but anyways, good luck, guys. Thanks.